So I'm here. We're ready to do our hand and finger video evaluation today. First off, I'm going to get a little patient history to see where we're at with that before we get into our full evaluation. So, who do I have with me here today?
I'm Steve.
Steve. Nice to meet you, Steve. Are you in school right now?
Yeah, I play for Arizona State football.
Oh, right on. What position you play?
I play linebacker.
Sweet. Nice. What brings you in today? What seems to be the problem?
Oh, my index finger over here really hurts.
Really? Okay. Where exactly? The whole finger, or like one spot in particular, or what happened?
If it was one spot, it'd probably just be like right in here.
Kind of towards the end, a little bit. Okay. When did this start hurting you?
It hurt right when it happened during the game.
Oh, okay. So it was in a game.
Yeah.
Okay.
I heard it during a game.
So kind of walk me through this scenario where you said linebacker. So you were on the field, obviously on defense. So what happened for the play?
So this guy came at me, and I tried getting around him. So I grabbed his shoulder pads, but he kind of went one way, and my finger got stuck in there.
Okay.
And I was trying to get it out, but it
in the pad or like in his uniform, or kind of, do you remember it specifically, or?
Yeah. So it was kind of like the pads go like this.
Okay.
In the neck. So like my finger was in there, and he kind of turned and like pushed my finger way back.
Oh, so it extended out this way.
Yeah.
Okay.
Yeah, it went back, and I was trying to get it out of there, so I was kind of like flexing my hand, and then I heard a pop.
Oh, you did hear a pop. Okay.
Yeah.
That's what I was gonna ask, if you heard any crack or kind of pop, weird sound from it.
Okay.
Have you had any injuries to this hand or finger in the past, or is this your first time with it?
This is the first time I've had injuries
Okay.
with this hand.
Okay. And are you experiencing like any numbness or tingling in your hand or finger or anything like that?
No, I'd just say it's just like a pretty intense pain right there, but it wouldn't be tingling or numbness.
You say intense. So what, on a scale of like 1 to 10, 10 you want to cut your finger off right now, what would you rate it as?
Probably a 6.
6? Okay. And intense, is that like a sharp pain that's always there, or is it more dull now, or what's it kind of like?
It's like a pretty intense dull pain, like it's but it's just like right there.
Okay. Is there anything or a position you can put your hand or finger in? Is there anything you can do to help that pain go away, or is it kind of just there no matter what?
I mean, if I try to like make a fist or anything like bringing it in, like that really hurts.
Okay. Is it so far, since you've had the injury, has it prevented you from doing anything? I mean, obviously you had to come out of the game and you weren't able to finish playing, but are you able to do normal things like write, for example, or do things like that? Does it prevent you anything?
Yeah, I mean, like writing or just like scratching something really hurts.
So just anything curling that finger?
Yeah,
a little bit? Okay.
right.
Okay. Right on. From here, we are going to use the quick dash score of the hand and finger for the patient, just to kind of get a better gauge of functional outcome measure tool of what the patient is experiencing, and if certain activities are easier or more difficult than others, type of thing. So it'll give us a little bit more background information throughout the evaluation. Now I'm going to go into a little bit of some observation, just kind of look at what's going on with the patient since he already gave me the history. So can I notice, are there any obvious deformities with your finger?
Yeah, there's no obvious deformities.
Nothing obvious, okay. Is there any swelling or discoloration you're having?
Yeah, swelling, and it's red.
Okay.
Yeah.
Okay. And I didn't notice you walk in, but were you like holding that hand, kind of guarding it or protecting it at all, or were you kind of just walking normal, or how'd you come in?
I was kind of walking normal, but I mean, I don't want to hit it on anything because that'll really hurt.
Sure. And is the pain just localized in that finger, or is there any discomfort you're feeling in the hand or wrist even, or is it just in that finger?
It's just the finger, just right here on the finger.
Okay. Good. All right, now I'm going to move into a little bit of some palpations right here So from here, I want to kind of look at the thenar and hypothenar eminence on the hand. Just kind of make sure these are all okay and intact. Any pain through here?
No.
No, nothing like that. And the central compartment of the hand too, in between. Anything in there?
Mm-mm.
No, nothing bothering you. Good. All right, from here I want to go move into the metacarpals a little bit, into the phalanges. All these fingers are okay,
Yeah, all those fingers are okay.
but this is the one that bothers you.
Yeah, right there. Oh, right there.
Towards the end of your finger.
Yeah, that really hurts right there.
Okay. Okay. Now here I want to test the patient's strength, kind of get a gauge of what he's feeling with his flexor digitorum superficialis as well as the flexor digitorum profundus tendons. So to do that, we're going to get him on a stable surface here. So just for the point of example, I'm going to stabilize here at the proximal interphalangeal joint. So he's going to resist against me. He's going to try and curl and flex the end of his finger, the distal interphalangeal joint. Are you able to curl this end of the finger?
No, I can't do that.
You can't?
Uh-uh.
It's stuck right there.
Yeah.
Okay. Good. Actually, one more test I do want to do just to rule it out. I'm going to do a little tap test just to make sure there's no fracture involved here. Anything there?
Mm-mm.
Even on
I
the
mean,
very
when
end?
you tap on there, yeah, that really hurts.
Little hurt. It's painful.
Mm-hmm.
Okay. But no, like, do you have any shooting pain going to an end point that you can feel, or is it just
No, it's
sore at that point?
Right, yeah, just kind of sore at that point.
Okay.
I wouldn't say it's like shooting or.
Okay. So he is experiencing some point tenderness at that distal end of the finger of the second phalange there. From what the information I've gathered at this point and kind of the signs from the special tests that we've performed, the diagnosis I would go with is that he has jersey finger right now of that second digit, due to the fact that he's not able to flex that distal interphalangeal joint while the proximal interphalangeal joint is being stabilized. Okay, so at this point we are going to splint in a position that makes the patient comfortable, but we're going to refer him right away to a physician that this tendon and this injury requires that surgery be performed to fix that tendon and repair the connection since it is torn from the injury. Excuse me. So from here, we are going to just refer him out to the physician. He'll be probably scheduled for a surgery to repair that tendon, and then we will look at a recovery time and get him back on the field as soon as possible with a return to play protocol. So, thank you.